Hi everybody, it's Adam, the geneticist and genomic data scientist here at Verdure Healthcare. And welcome to the part 2 of my introduction to genetic diseases and how to avoid them on our Genes That Can Make Your Baby Sick series. Now, today I'm going to talk about the single gene disorder. So these are the genes that has just been changed in one or two very small little parts. Now, just to tickle your memory, last time we've talked about two main types of genetic diseases. The one would be chromosomal abnormalities, for example, Down syndrome, whereby on the 21st pair of chromosome there is an extra piece, so that is on the level of chromosomal abnormalities. So if you haven't watched my part 1 video, I would strongly suggest you to spend some time watching it so that you'll be able to fully understand what am I going to say next. Right, and just to refresh your memory, every single one of our cells, they have a command center called the nucleus. And within the nucleus, there are the commanders of the cell. It's called the chromosome. So when you unpack a chromosome, just like when you unpack a ball of strings, you can see the genes inside it. So that's not the deepest level. Yet, if you look into it, you can see the GCAT, ingredients of a gene. So yes, all life forms on this earth, whether it's a plant, whether it's an animal, whether it is us humans, we are made of the same genetic ingredients. Alright, if you want to know the fancy name, it's called the nucleotides, but genetic ingredient would do for now. Anyway, so the diseases that I am going to talk about today is this category. So there's just one or two parts of either G, C, A, or T that has gone wrong, and that can cause you spinal muscular dystrophy, for example, alpha thalassemia, Niemann-Pick diseases, Wilson disease. These are horrible diseases. So here are some examples, and I do apologize in advance if that makes you feel uncomfortable. So, okay, this is called PKU, Thighsex Disease, Bloom syndrome, and Joubert syndrome. Anyway, so sometimes, okay, for example, Joubert syndrome, it looks like a Down syndrome baby, but it is not just intellectual disabilities. There are so many more things that come with it, and in the future series I will talk about these diseases one by one, so stay tuned for them. Anyway, so if you can see this picture, if you can have a look, zoom in and have a look at the parents of this baby, do you think that this couple is a special couple? Honestly, I don't think so. If I see them in a shopping mall, I don't think there's anything wrong with them. But how can they have a Thighsex baby? By the way, Thighsex is a very horrible disease, and I'll speak of that in future videos. Alright, so it happens by mom and dad carrying the same mutated gene, and in this case, the Thighsex genes. So if you are a carrier, there is actually no chance for you to show the disease because there isn't enough power, right? So if that's the case, there will be a 25% chance the baby getting a Thighsex disease. So 25% chance, is that a good gamble for you? I don't think so. Majority of people would say, no, Adam, it's just way too high, right? Unacceptable. So there is a 50% chance for the baby to be like the parents. They're carrying the Thighsex disease gene in them, and they will never show the symptom. And of course, in that case, you wouldn't see them on any article, interviews, or any newspaper report because there's nothing wrong with them. They will never even know. There are certain people who never know that they are actually carrying some kind of genetic disease. Now that's the danger. So if I just want to draw a memory, last time we've also spoke about the Chicago School of Medicine, their research back in 2015. Remember, every normal human, every healthy human will at least carry 1 to 2 genetic mutations, and that is exactly what happened. So there will only be 1/4 chance of the baby escaping, from this, all right? So then, in summary, 50% chance the baby will be a carrier just like the parents. There will be a 1/4 chance the baby will escape completely, and there will be a 1/4 chance the baby will be affected by the disease. So let's speak of another scenario. Okay, maybe a less severe genetic disease. But okay, if the father is a carrier and the mother will be affected by this genetic disease. Now, the reason why I'm saying will be because there are certain genetic diseases that might not show until at a certain age. For example, maybe 40 years old or 30 years old, only then you see the symptoms. Okay, Steve Hawking is an excellent example. If you have seen their movies, you see that he was okay during his, childhood, but when he goes to uni, slowly there will be a problem because he can't feel his muscles. Right, this is exactly the problem. So if that is the case, nobody will be able to run away, right? So 50% chance the child might be like the mom. There's a 50% chance that there will be like the father carrying the disease. So in this case, nobody can get away. So what can we do if we are really at this stage is that we need to do something called IVF, in vitro fertilization, but that's not it. We need to use the pre-implantation genetic screening and pre-implantation genetic diagnosis technology to select the embryo and just to make sure we don't go for the ones that are being affected or will be affected. Anyway, so after choosing the embryos in the future, hopefully one day they will marry somebody either carrying a completely different kind of disease, or they're married with somebody without any carrying diseases at all. And in that case, through this generation, they can get pregnant naturally without having to go through any kind of embryo selections. Right, so there are 3 kinds of genetic code mutations: substitution mutation, insertion mutation, and deletion mutations. Let me introduce you to them one by one. Okay, so often I would say that genetic codes are like stories, again, like some words in the storybook. So you can imagine this. Within a storybook, it says Sam met Batman, right? Easy enough to understand. So in a substitution mutation, imagine the B has changed to a C. Sam met Catman, right? Okay, maybe, you can understand it, but what if this is a human disease? Okay, what can it do? So sickle cell anemia is one great example. So what does this do? Okay, so this is a red blood cell. It looks like a donut shape with a bit dented, in the middle. So this is a normal red blood cell. But if the red blood cell has changed to a moon shape or a sickle shape like this, there will be a problem. Why? Because our blood vessels are not designed to have moon shape or sickle shape red blood cells. And that will clot your blood vessel, and that's not really good because you're going to feel immense amount of pain if it blocks your blood vessels. But what happens if the blood vessel is around the heart? Imagine the aorta, one of the main blood vessels in the heart, get blocked like this. How about if it's in the brain? You're going to get a stroke. So this is a time bomb, sickle cell anemia, and it's one of common examples of substitution mutation. So another one, insertion mutation. Imagine this: the same sentence, Sam met Batman. I'm going to insert a letter, any kind of letter into any space. Have a look at this. Sam, Mel, TBA, TMA, and you can't even pronounce or read it. So in our body, or more specifically in our cells, there are gene reading machines that can make these instructions into something useful. So imagine if you are that machine and you are responsible for reading genetic codes, can you produce anything with this instruction? Probably not. So what's going to happen is that, this machine is just going to skip through this, nonsense, and there will be a functional loss in this section. Right. So a good example would be Huntington's disease. So it affects the brain. So this is the normal brain. You see it's healthy, there's no hole in there. But if it is a Huntington disease brain, there will be such a big hole in it, in the brain, then the baby, when they are first born, they might look okay, they might be active, but slowly this baby is not going to move anymore. Right. And Fragile X syndrome. Fragile X syndrome relates to the chromosome X. Right. So it's very important to understand how chromosomes work. So as a reminder, in boys or in guys, we have one X chromosome and a Y chromosome. In ladies, there are two X chromosomes. So for guys, if we get this X chromosome or Fragile X syndrome, then straight away we will be exhibiting maybe say autism, violent behavior, and even slight intellectual disabilities in some cases. Why? Okay, because we're just carrying the disease. Why are we getting, or why are we being affected by it? Okay, it is just because if our own one and only X chromosome is being affected, there is no good copy of the X chromosome to back it up, right? Unlike in ladies, if one gets mutated, the other X chromosome is okay, right? So in this case, if parents are being either affected or carrying the X chromosome syndromes, so then we will be asking them or suggesting them to choose the baby girls. Anyway, so another very common disease related to this category is the muscular dystrophy, like Steve Hawkins I just talked about. Right, and so the last kind of mutation is the deletion mutation. So using the same sentence as an example, Sam met Batman, imagine if I were to take away any letters within this sentence. Does that make sense to you? Sam, me, B, A, T, M, A. Still doesn't make any sense at all, and still there will be a functional loss in your body. So a very good example is the DiGeorge syndrome. So let me guide you how to read some codes. Okay, DiGeorge syndrome is often known as 22q11.2 deletion, right? So what does that mean? Okay, 22q is actually the chromosome number. So this particular gene is on chromosome 22, Q, and then 11.2 position, right? So just for your information only, you don't have to really remember this. Right, so DiGeorge syndrome is very often being exhibited with cleft palate, the inner mouth, the upper mouth being cracked, and then also the lip, cracked lip and the palate. But that's not it. Often, DiGeorge syndrome kids, they will also have intellectual disabilities along other complications. And then cystic fibrosis, it means that the mucuses in the lungs gets hardened. Okay, so when it gets hardened, it's going to clog other organs as well. For example, the pancreas, the intestines, and in guys, if we get this kind of disease, the tube that we transport the sperm out to our body will be gone as well. So the sperm tube, now I want you to learn this, the sperm tube, the proper medical name is vas deferens, okay? VASDEFERENS, vas deferens, okay? Right, So are there any treatments if you are getting genetic diseases? Well, very unfortunately, still at this moment, we don't have complete cures. So at maximum, we can only have something to smoothen the pain or just manage the symptoms. But as soon as you get off the treatment, you'll be in trouble. So the sources of genetic diseases can be separated into 5 types. Okay, mutated gene, mutated protein, metabolic dysfunction, organ malfunctions or clinical problems, and of course that will in fact affect the family and the society. And there are different treatment options. For example, mutated gene, it can be transplantation of the organ or gene therapy, but that is at an experimental stage. Right. So in that case, we have to avoid genetic diseases because honestly, I would consider as having no cure still at this moment. So how do we know if we are inheriting any genetic diseases at all? Okay, through genetic tests. So if you remember last time we talked about the pre-pregnancy DNA screening. Now this is one of the screening by law in some Middle Eastern countries. Yes, in Middle Eastern Arab countries such as Saudi Arabia, they are making this a legal requirement before you get pregnant. Yes, why? Because it's very common in countries like Saudi Arabia to marry one of your close relatives. Okay, not the taboo ones, okay, but maybe first or second cousin, so it's very common. And as you can imagine, it is from the same family line. So if you're getting, for example, a blood disease called hemophilia, then most probably your other family members along the line are getting hemophilia as well. So in that case, they are using such tests, okay, to screen out and also potentially ask them maybe not to have any babies. But in our country, in Malaysia, we are much more open. We can use other options such as IVF or pre-implantation genetic diagnosis that I've just mentioned just now. Right, and this is one of the sample reports, and it is one of the real reports that we had previously. So if I'm not mistaken, this is one of the lady customer, the wife, all right? She was carrying 3 diseases: beta thalassemia, Smith-Lemli-Opitz syndrome, Wilson disease. Okay, so you can see 3 diseases here, and this is the genes that are being affected, and I will tell them to, and I will let you know why are they affecting such functions in the future series. But anyway, so that's the report, okay? So if you ask me, okay, are there anything wrong? Is there anything wrong with this lady customer? No. When she walked in, she was completely normal, just like you and me. So that's why we need to use such an advanced genetic test in order to know and screen them out. Right, so you might have an impression saying that, okay, the report is quite complicated. And yes, it is quite complicated. So that's why you need a proper and a certified medical professional to guide you through. And to be honest with you, analyzing the report is not the most difficult part. Okay, if you go back to one slide, you can just tell the client, okay, what disease, what gene, blah, blah, blah. But what about the solution? So if after they've gone for the test and they get pregnant naturally just like this, then there's no use for the testing. And that is why the solution is the more important part. And it's quite difficult nowadays to find a medical professional that can analyze these reports. So basically, here's what you need. Okay, you need a medical base. Okay, so you need a baseline qualification. Like myself, I have a postgraduate certificate in surgery from the Royal College of Surgeons of England, and I'm qualified as a surgical instructor, and I'm able to teach surgery to other medical professionals, including doctors and nurses. But that doesn't mean that when I hold this qualification, I can talk to you about genes. No, I have to get further education such as this, Stanford Genetics and Genomics Certificate of Achievement. You might have heard me talking about this in the previous part, but I have to emphasize it a little bit. Why? Because this is only the foundation of genetics, okay? If you want to offer something like, in previous slide, in the previous part, the cytogenetic testing for the chromosome, you need something related to cytogenetics, okay? But if you want to offer this kind of genetic testing related to just, one or two bits of gene mutation, there is a special criteria, okay? That's why we need to get further training specifically in genetic testing and their sequencing technology. So what's sequencing technology? All right, when you line up all the genes all together, that's called the sequencing technology. You need to line up the genes and you need to compare that with a normal human gene. Only then you'll be able to find out, oh, okay, there is one code that is missing, one code that is extra, or one code that has been substituted by something that shouldn't even be there, right? So that's one level deeper. And if you want to really understand and also to plan what genetic tests are suitable for the clients, and if you want to plan the results well, then you have to get one further education in genomic data science. So the data is just too huge, and that's why we call it data science. So as for myself, I'm qualified as a next generation sequencing data scientist. Next generation sequencing, or known as NGS, is the current technology to do genetic sequencing. So if you're in your own free time, if you're interested, you might want to search that up as well, because in the IVF centers, such as Alpha Fertility, TMC, they are also using the NGS technology to do pre-implantation genetic screenings. Right, okay, so after you get your results, whether or not you have any kind of carrying diseases, you should still bootstrap the quality of your sperm and egg cells, right? Why? Okay, one thing is that, if you can remember what I said previously, often a birth defect can be something not related to genetics. It can be something called spontaneous. It happens by itself, and we want to lower the risk. For example, Down syndrome is actually not inherited. It is considered a birth defect, right? So we want to reduce that chance. So in that case, we need to boost up the sperm quality. So anyway, I would like to use this opportunity to thank everyone, because speaking of boosting sperm and egg health, we have a number of a range of products that can help you do that. They are supplements, and our supplements has won the Reader's Choice Award 2021 by the Baby Talk and Mama Papa magazine. So I'm not sure whether you have seen one of their magazines displayed in bookstores, but they are quite popular. So there are three kinds of products that are very useful in doing that. So our VHC formula female 1 and female 2 would bootstrap the reproductive systems in female, right? So whether or not you're planning for an IVF or natural pregnancy, this is usable definitely, because we are aiming at the at boosting the ovulation function and also the egg quality. And also we have something called the VHC formula male, whereby we bootstrap the sperm's quantity and quality in terms of their shape, swimming capability, and also their general quality. Yeah. And also one of our award-winning supplement would be the confinement, or confinement would be the afterbirth care, right? So we prepare you for the next baby, or if, let's say, unfortunately you've suffered a miscarriage or termination of pregnancy, this product is also very suitable in getting you recovered. So there are more information, so please visit our website at www.verdurehealthcare.net. Right. And also, nevertheless, I would like to thank everyone for your support because Verdure Healthcare has won the Super Brand Award and we are now officially a Super Brand company as of 2021 Malaysia's choice. And this is something really, really proud because according to their administrations, there are 3,000 judges to judge our method of operations, our products, our branding, everything that you can check in a company, and we still won this. So yes, thank you so much, everybody. Okay. On the last step, step 3, contraception. Conception, sorry. Natural pregnancy or IVF with PGS, PGD. If you don't have any carrying diseases, then you should go for natural pregnancy. Why not? Or unless you have blocked fallopian tubes or something like that, then you might need IVF. But if you are a healthy person without carrying any genetic disease, why should you be going for IVF? Right, so in that case, we do have something called the Home Artificial Insemination, IUI, where it is just 1/50th price of IVF, and there are just 3 simple steps to achieve the dream. So let me introduce them briefly to you. The first step would be to learn how to grasp your menstrual cycle. So this is extremely important because if you're not grasping your ovulation, then there's really no point in trying to get pregnant because you're missing the most important thing. So this is our 17 years of experience. We put that up together for you so that you can follow our instructions easily and to predict your ovulation, the best time to get pregnant. So if you're around, if you have done a few records already, 1 or 2, then around this time, around the peak time, you can use something called the LH ovulation test, whereby it is to test whether or not you are ovulating. So it's extremely accurate. We are importing such products from England, and a lot of our customers are finding this very effective. So on the third step, we need to use something called the baby maker. So this is the insemination kit. So some of you might have heard of IUI before. So this is the IUI kit, except it is non-invasive because you don't need to insert anything into the uterus. Okay, so this component here, this package here, includes a component that can transport the sperm directly just outside of the cervix. You don't have to insert anything into that. So it is a shortcut for the sperms, so they don't have to swim that much, okay? And in turn, that will at least increase the chance of success by 50% because that's how much the sperms are getting a shortcut, right? Okay, so we have full instructions. So the moment you purchase one of this package from us, from Verdure Healthcare, we will send you an instruction manual via email, and all you need to do is just to follow the instructions step by step. Okay, so as I mentioned before, there are only 3 steps to success. Right, and so this is particularly suitable for someone who's already got a lower sperm count, either poor motility or abnormal shape. It strictly doesn't mean that there are some abnormal genes in, for example, poor motility sperm. No, not really. As long as you get yourself checked, and of course we strongly recommend you to use VHC male to boost up your sperm quality. And for ladies, who has especially high amounts of antibodies or suffering from recurrent genital infections or pain during intercourse. Right. Okay, if on the other hand, unfortunately, you've been tested positive for some kind of genetic diseases that you're carrying, like the sample report, so then we would recommend you to still boost up your sperm and egg quality and to go for IVF. But that's not it. IVF is not it. We need PGS and PGD technology. But which one should you use? Because PGD and PGS are 2 different technologies. Now, PGS, the screens for chromosomal abnormalities. So for example, if you have translocations, something like that, then you should use PGS. But if you have genes like beta thalassemia, then you need to use PGD technology, right? So how is this done? Okay, when is it going to be done? So this is a summary of an IVF procedure where when you see the doctor, he's going to do some exams with you, physical exams or an ultrasound. When you decide to take up the treatment, then you need to stimulate your eggs. So after around 2 to 3 weeks, you go back to the hospital and the doctors will take your eggs, fuse them together with your husband's sperm, and then they will put that into the lab, and then, put that into the incubator for culturing, and then afterwards, around 5 to 6 days, they would take the embryo and then they would extract a few cells, just like this, although this is a graphical picture, so that they can test for abnormalities inside the embryo. Now, there are people who ask me, Adam, why not just save the processes and just go straight away for PGS, PGD for both? Okay, one problem is, of course, money, because you can go to Google and you can search costs of PGS, PGD in Malaysia. You can easily, appreciate that it can boost your entire cycle, to around 35 to 50,000. So that is a lot of money. And very often, if you need more medication, we have got quite a few clients who spend around 70,000 on just one IVF cycle getting only PGS, right? So all of our effort is to help you save money. And of course, there's another issue. Okay, let's go back to the previous slide. Okay. Right, so if you're seeing this picture over here, the embryo is this small and the needle is this big, and they are going to take the cells to do the testing. So in that case, wouldn't that hurt the embryo? Yes, it will. Yes, it will, honestly. So unless absolutely necessary, we wouldn't recommend any clients to go through this procedure. Right, so yes, if you do need IVF centers help, we do have a number of partners, including Sunway Fertility Center, Thompson Hospital, Alpha Fertility Center, TMC, and we will be able to follow up your cases as well. Right, and then one very last thing, your genes will determine your baby's lifetime health. So making sure a baby is healthy actually starts today, today when you're watching my video. So well done. I mean, thank you so much for staying with me throughout this entire length of time. Now you are truly, a genetics expert in your own will. So then, yes, congratulations on that. Okay, so this video, if you have time, I'll strongly recommend you to watch part 1 and part 2 again, because honestly, we have been training as a geneticist for over 5 years. So only then I'm able to put all of this stuff for you to appreciate. And then, yeah, genetics is really not easy. So if you have this video after our first Facebook premiere, it will be put on YouTube. So please do like our videos, subscribe to our channel so that you get to know what am I going to say next about genetic diseases, and share this video to somebody who's going to plan for pregnancy. Thank you very much once again, and I wish you a wonderful day ahead.